So right now, is Monica online? No. Neil, you are here. I see you here. Thank you. Elizabeth Boyce. Elizabeth, thank you. Mackenzie. Oh. Mackenzie on? Ernie Dole. Elizabeth Dyer. Phil Feudy, I saw you there, Phil. So there we go. Leslie Ann Hayes, she did let me know she would not be able to attend, but just in case, Leslie, were you able to make it on? Yep, okay. Steve Jankuski. There you are, Steve. I see you right there. Thank you. Joanna Katzman. Liz Lacouture. Oh, there you are, Liz. Thank you. Andrea Maloney. Sharan McCracken. I thought I saw Sharan join. Oh, I see you there, Sharan. Are you having some, it looks like you may be having some issues joining. I see your hand up. Okay, perfect. Sharan, if anything comes up, if you're having issues with your Audible, just put it in the chat. Scott McFall.
Present.
Thank you, Scott. Darcy Pope Wyatt. Okay. Charles Schumacher. And then Randall, we know you're here. Randall Starling.
Yes, sir. Here.
Perfect. Brandon Taylor. Brandon Warwick.
I'm here.
There you are, Brandon. Jennifer Weiss-Burke.
Yes, I'm here.
Thank you, Jennifer. For some reason, if someone doesn't say something, you're not always popping, people aren't always popping up on the screen. So if I ask, if I miss somebody, please raise your hand, because those also seem to be popping up and showing well. And we actually do have a quorum at this point, so that is perfect. So we can continue with the rest of the meeting. Essentially, I'd sent out the meeting agenda a couple of weeks ago. Were there any additions or changes that need to happen on the agenda? And I'm going to share my screen with that agenda on it so everyone can see. Okay. Any changes or additions? Essentially, we have the review of the minutes, membership status, reports from legislative session, subcommittee updates, other business, and then next meeting. Hearing no comments, can I take that as it is accepted and we shall move on? I see thumbs up, so we'll move to the next item. So the next item is the review of the minutes from the last meeting. And again, the main portion, since we are recording these meetings, is we do utilize those recordings for the bulk of discussions. And really the minutes are containing either highlights or main points and any decisions that actually occur. So are there any questions about the minutes that were sent out? They also can be found on the program or on the council website. And so they are there. And I'll give everybody a couple of moments to look through it, see if there are any changes or additions. Any questions, changes, concerns, additions? Welcome, Andrea. Thank you for being able to join us this afternoon.
Hi, everybody. Thank you.
So, Andrea, we're just on the minutes right now from the last meeting.
Okay.
And so far, nobody has any additions, changes, or questions.
Okay.
Okay. So if there are no additions, changes, or questions, may I ask if we can change this from the draft minutes to the regular minutes? Anybody? Neil,
Yeah, so
are you
moved.
making?
Steve.
Okay, Steve has made a motion. Neil is seconding. Okay. Any objection? All right, we will move forward with the agenda then with the minutes accepted. And our next step then is going to be council membership status. And actually our membership has not changed at this point. We are still full. While we have had a few people who were not able to attend this meeting, they are individuals who have been in attendance regularly. And the majority of them did let me know in advance that they either had other commitments or conflicts. So we have that. Any questions about membership for the council? Okay, all right, so let's move on to reports from the legislative session. Before I start talking about some of the things that happened, I'd just like to open it up to anybody else who had been involved with the legislative session and in attendance, especially with regard to items that came before this council and some of the recommendations. Is there anybody who would like to talk a little bit about their experience with the legislative session this year? Nobody? I will take that meaning then that everybody had a wonderful legislative session. I do know that with our recommendations that we move forward, there was activity around every single recommendation. Some items actually had multiple bills, and they actually were very successful. The only one that really got completely sidelined was the one with regard to the overdose prevention centers. And that did make it through on the Oh, Phil, you were there as well for much of it. Now I can't remember. I had so many bills happening. It made it through on the Senate side, but didn't make it to the House. Am I correct on that? Or no, I'm sorry, it made it through the House, but not to the Senate.
Right, and it didn't receive a floor vote. Wasn't on the
Right.
agenda on time to receive a vote. So
Right.
I think from the summary on that that Emily Kaltenbach had sent out, what was encouraging is that, and I experienced this in some of the committees where I attended for that those that were in favor of it very much understood what it was supposed to be and what it was meant to do, and were enthusiastic about that support. So I also experienced I think some of the complications, and it's only reasonable that some of the things that we tend to be observing happening on a national level play out also in that context. And some of the questions that I heard from people in opposition to it were so left field. I don't think anybody was prepared to answer those questions, right? Things about the children and sex trafficking and all kinds of other stuff that no one would have anticipated in the context of discussing this. So,
and for those who weren't either privy to the hearings or didn't hear them, there were questions that came out like, so you're going to allow 12-year-olds to shoot up And are you going to report sex trafficking, potential sex trafficking individuals who show up at the site, those kinds of things. And they just weren't, yeah, like who would have thought about asking those kinds of questions? So, yeah.
Well, the sex trafficking question, I think, came, that first session was immediately following the Super Bowl. And for those of you who pay attention to those kinds of things, there's a lot of debate. There's this thing that has entered the collective consciousness about the Super Bowl being a hub of child sex trafficking. And I think those folks even ran a commercial during it. So I wasn't actually surprised that all of a sudden was part of that, got introduced as a discussion point in that committee hearing. But also, I mean, yeah, no one was prepared to be like, what?
Right. Okay. Other items or comments from the legislative session?
I'm sorry I was a little bit late, but I just wanted to let you know that the copay bill passed to lower copays for chiropractic medicine, and the Medicaid pilot project will move forward. So that'll be a lot of increased access to conservative pain management options.
Fantastic. Thank you, Michael. Yeah, what I had just said is I was hoping other people would talk a little bit so it wasn't just me. So thanks to you and Phil with regard to that. There really was a lot that was happening during this legislative session, not just with our bills, a lot of bills with regard to substance use, with regard to MOUD, with MAT situations, incarcerated settings and treatments. There really were a lot of bills that came out, and I'm not sure what the final tally for HSD was, Neil, but I know for Department of Health, there was about $4 million that has ended up being allocated specifically with regard to opioid, fentanyl issues. And so there'll be some programs that'll be coming out, many of which will be, centered around, various forms of mobile treatment and other types of clinic treatment. And so some of those of you who are doing this work in clinics and community health organizations and some of the other nonprofits and agencies involved, I'm sure you'll be hearing more about those soon as those plans are finalized.
I'll just jump in and say HSD did quite well with the reappropriation of the opioid settlement funds. We got about $6.5 million. 5 of that 6.5 million was a complete surprise to us when we got it, but welcome surprise. So that's good. And I'll flag, and I know Catherine, I mentioned this in an earlier meeting today, so you can close your ears when I say it, but I think, and I got a legal opinion on this as well, that the legislature inadvertently narrowed the scope of the opioid settlement, what the opioid settlement funds can be used for. The original settlement was pretty generous about being able to be used for multiple substances, not explicitly opioids. And I don't think the legislature did it on purpose, but it's something we need to watch.
Right. That's a great point, Neil. Thank you.
Is that something that could be shared with the group? Because I think the group, the committee here in general is in a good position to make some recommendations on how to spend that money. I'm always a big fan of people before me who did like the tobacco settlement money. I think being able to still have a New Mexico Quits hotline 25 years after that. Selfishly, some of that money supports the Poison Center. Yet, I think it is incredible, and I would hope that with 500 million coming into the state, that in 25, 30 years from now, we still have opioid money around helping people.
I would agree, Brandon. And yes, we'll see what we can get as far as that moving forward. Some of it was very specifically earmarked, so there won't be much leeway with regard to it, but other aspects there may be. And we're also going to as some of those plans are also developed, we're going to be reaching out to those programs to ask them to come and talk about that so that there can be input from this particular council. Okay, any other questions or comments about the legislature? And I should rephrase that, about the legislative session. No? Okay, well, let's move on to the subcommittee updates and recommendations. And so the first one we have up is the formerly known as Fentanyl Subcommittee, but the Emerging Trends. And Phil, I know that you were working on that and having some of those meetings, so I'll turn it on over to you.
Great, thank you. I didn't want to like talk all about the sessions because that's half of the report. So our recommendation for the OPC thing did end up stalling this year, but I think it is still to be considered an open recommendation. It's my belief that this is going to be revisited again in the future. So I think we can go ahead and keep that one on the board. The MOUD and corrections bill did pass, which is very exciting. I think, and that Brandon just mentioned stuff with the tobacco money. I think that in the very first committee hearing for that, the proposal had included utilizing some of the opioid settlement funds for that, and one of the committee members had said, no, this is too important actually for all of this to get potentially hung up by some of the complications that we've experienced historically with things like the tobacco funding. We think that our recommendation is that you reallocate this, that the state should support this as a thing because of its importance. And so I thought that was really refreshing at the beginning of that. And I think the only other major change is they extended the date to when it's supposed to be fully implemented by to 2026. So that was really exciting. I think our timing was right on the money with that as for the council and for the committee. It got a lot of people talking about it, and got a lot of it just meant that the support for Nathan when it got introduced was already all there. So and special shout out to the committee members, Chloe and Anna and Catherine and Roberta and Elizabeth and everyone else who threw in on that. I thought it was a really cool thing. Additionally, we also had an open recommendation from before regarding advanced drug checking, implementing drug checking services in the state. And I don't see Josh on here. And I don't know if anyone else can speak to it, but there was a posting for a job under Vital Strategies to look to implement that project within the state. And so that is something that is actually happening in real time. And I think we could consider moving that one over into the completed pile. So I'm not sure of all the details, but I know that that is one of the strategies that one of the things that Vital Strategies is going to oversee. It's a fairly complicated process, and but yep, I think that's cool. So that one, House Bill 52 addressed the legal part of being able to do that, and now we're actually moving to implement that in the state, and that will come in really handy, particularly since we changed the name of this, and since the last time we met, there have been some potential emerging threats happening. The state crime lab a while back indicated that they had identified some xylazine, and it's part of the reason that having our own drug checking in the state will be really advantageous. Is nobody historically really has access to what that means when the crime lab finds it, or we have to wait for the mortality data to be released. And so no idea whether they found one sample of something or a bunch or what part of the state it came from or any of those kinds of things, but they did say that they had found that. They had also found some of the illicitly manufactured benzodiazepines and counterfeit Xanax. Again, not a lot of information around that, but those real things that are happening. There have been throughout the North in recent week or so, week and a half, actually going back to February, where the Mountain Center, the harm reduction program in the North, and some of our participants have begun reporting experiences that are consistent with xylazine potentially being present in the drug supply up there. People reporting that they bought some fentanyl and did it and were woke up 4 or 5 hours later, rather than 20 or 30 minutes. People presenting with odd wounds on their fingers and things seemingly out of nowhere and not related to injection. After seeing our naloxone distribution and reported overdoses and things reach an all-time low in May and October of last year, all of a sudden in February, we had a whole series of high multi-dose use reports from people, and some complications. And then, as many people are on here are maybe aware, there was a cluster of 4 overdoses that were very complex and ended up in the hospital up in Raton. Coinciding with that, we received reports from the North again, from south of Santa Fe and Cerrillos, from our clients down there through Espanola, and then in Raton also, that there are some oddly shaped and colored tablets in circulation. Very unusual, something that I've been talking with my colleagues nationally, no one else has seen, but they're not round pills. They different shapes like stop signs and things, and people have been indicating that those are responsible for complications that they've been experiencing. So the good news is that we had some samples that we had collected already in Espanola, and we were able to get with a colleague right on the ground in Raton last week and collected several samples from them, including one of the oddly shaped pills, and got that sent off to the lab last weekend and are waiting patiently for the results, hoping that happens by the end of the day today. So more information to come on all of that. DOH did issue another health alert. Just on xylazine, I think that the one thing I really want to encourage people with this is not to be referring to people as zombies, not to be talking about flesh eating and flesh rotting and all that kind of stuff. And that, the naloxone doesn't work on xylazine. It doesn't work on 99.999% of other things either. You know, in addition, we've always had complicated overdoses, and we've always had difficult wounds and stuff to treat with people. And so I think nationally there's sort of a crisis right now because the harm reduction community in general has not been able to come up with any particularly meaningful harm reduction interventions that people using drugs can practice with the presence of xylazine around. And so it's my personal belief that what we can do that is still harm reduction is really push back on the stigmatizing sort of craziness that comes along with these things, because it leads to people to being treated poorly when they are accessing help and things for situations like this. You know, they end up getting treated like zombies. Right. So I think that until we know more about these things, that's our best course of action. So.
Great, thank you, Phil. And that's a lot of good information, especially with regard to some of these upcoming trends and threats that are happening. So does anyone else have any questions, concerns, comments?
Did Brandon Warwick here. So we've had multiple cases at the Poison Center that are reported to across the state. We're trying to, I spent a fair amount of time this week trying to get Tricor to participate in sending samples and stuff off through the DEA Tox program. I think for this, they finally agreed to do it. I haven't heard if it actually shipped, which is something that I need. So I'll follow up with them. They're not supposed to ship it on Friday. So I'll follow up Monday. But talking with Haley and talking with Luigi, they were anticipating or going to plan to update the HAN alert to call the Poison Center so that we can help with tracking the epi. I work for the Poison Center and I'm biased for them. It's more work for me, but I think having an agency that's 24/7, 365, and that is able to give free medical advice is a huge incentive for just reporting. Even if you don't need medical advice, I think that's an easy tracking way to do. And then we obviously will share, have already data use agreements and everything with DOH that we're sharing back at. We being the MedTalks community had our big spring meeting. Xylazine was a big issue of discussion, and some of the take homes from that and people who have been seeing xylazine longer than what we have in New Mexico, especially our colleagues in Pennsylvania, is it still sounds like there's a fair amount of debate over these skin lesions and how much of it that's associated with xylazine. I almost said the word levamisole, just a little prematurely, but levamisole has been in our drug supply for well over 10 years now, 10, 13 years. And that is also associated with causing some of these necrotic skin lesions and things too. So I think it's really important to support Phil and whatever I can do with and other testing, so that we actually know what's in our drug supply and that we're not waiting 6 months or realistically a year when the new fatality data comes out and what was in that, because it's changes like the xylazine. We're seeing that today. The users will have already adapted to it by the end of the month. And in the community, it just seems silly for us to be so outdated 6 months, 9 months, a year later, starting to make recommendation policy changes.
Thank you, Brandon. And just for those who are not able to see the chat, Catherine mentioned that about the HAN, the health alert that was sent out regarding xylazine. Paul, I know that you're on. Do you happen to have that one pager that Catherine mentions that has the points that Phil had raised on it?
Give me a second to look for it.
Okay, and if possible, if we could share that through the chat. If not, we can send it through the group. I think that would be really good to have. Thank you. And then Scott, you had mentioned that about the Region 3 narcotics in the northern half, that yes, indeed, you can confirm all of this information pretty much, especially about the fentanyl pills coming in various shapes, sizes, and colors now. So thank you both very much for those comments. And then Jennifer, you have your hand up.
Yeah, I just wanted to ask a couple questions, Phil. Do you know how it shows up in a urine screen, the xylazine?
Well, it doesn't unless you are using a UDA screen for it, and which are now available. BTNX does the fentanyl test strips that are most popular. Last week they got approval, and they're available. They're a little pricey still, but I think they're close to $2 a piece or $1 something a piece. But those can be added. The strips, yes, those can be added. Yeah, for that. I think DanceSafe is going to be coming out with their own version pretty soon. As far as clients or participants using those to test substances, they're not as straightforward as the fentanyl test strips were. So there's going to need to be some education and some independent materials developed for that. But they are immediately available for UDAs.
Okay, great. Thank you.
Mhm.
Any other questions, Jennifer?
No, that's it. Thank you.
Nope,
We haven't
okay.
seen it yet. No, coming. We haven't seen it with our clients yet, but that's why I don't know. I mean, if it's not showing up in the UAs, we could have, it could be present and we just haven't noticed, but we haven't had anybody report any symptoms like what I'm seeing in the news and stuff like that.
So it's an alpha-2 agonist, and so basically blocks dopamine catecholamines outflow from the brain. In other words, it takes away a fight or flight response. So clinically, we expect to see a little more bradycardia and or hypotension than just generally what we associate with a straightforward opioid overdose. That's how other drugs in the class are also present.
Brandon, isn't that ironically like clonidine? Isn't it a cousin of clonidine that historically has been used for tox?
Yeah, clonidine, guanfacine, Xanaflex is the trade name. The generic is tizanidine. Dexmedetomidine or Precedex we use in the ICU, but they're all alpha-2 agonists. Thanks, Steve.
Yeah, no, interesting. Ironic.
One thing I wanted to add too, based on Jennifer's question, is the CLIA waived benzodiazepine test for urine drug screens was approved about 20 years ago, and there are some of the newer prescription benzodiazepines that they don't identify. The two most common illicitly manufactured benzodiazepines, one being atizolam, is not detected by the current technology, and the other one, bromazolam, it's iffy. Like it does based on certain situations and it doesn't on others. So if we end up seeing more of those things happening, that's something else to take into consideration.
Thank you, Phil.
Yeah, Dominic, can I make a comment? This is a totally different drug to Phil, talking about rising issues. And again, this may be very far from the street, but if you all are aware of inappropriate use of ketamine, could you let me know? Because we're starting to see potential internet prescribing and prescribing for an experience, not necessarily to treat a legitimate illness. So if you all are seeing clients that are having trouble, usually one doesn't usually get addicted to these kinds of drugs, but it has been abused in the past. So if you all see any issues around that, if you'd let me know, I'd appreciate it. And similarly, you've probably seen in the papers internet prescribing of Adderall, ostensibly legitimate, but inappropriate prescribing with the DEA and other pharmacies shutting down some of these internet prescribing groups. If you see any of that kind of stuff going on, please let me know, because we're going to start looking into this with the assistance of the DEA and maybe Sharan and Nursing Board.
Great, thank you,
Thanks for
Steve.
the
That's a good
announcement.
point.
Yep.
Yeah, no, thank you.
You know, I can speak for the UNM's addiction clinic. Adderall is frequently on shortage. We discussed last month or last time the not being available buprenorphine, but Adderall is one that's frequently up there. I wish people wouldn't go around the doctor or around the pharmacy, but I also kind of question, you know, if it's not available, what do they do? If somebody asks me for acetaminophen because their back hurts or they got a headache at the meeting when we're back in person and I have some, I'd be happy to share it. I think the same thing happens on the street, unfortunately.
Right, thank you, Brandon. Okay, any other questions with regard to emerging trends? Okay, well, let's move on over to our next, oh, yes.
Dominic, hi, this is Joanna, long lost participant. I had a question for Steve. Good to see everyone. Steve, do you know, or Brandon, do the internet sites, are they, I mean, knock on wood,
I don't
know.
so.
Are they safe, or they, you know?
No, it's usually prescriptions. So it's your local pharmacy that gives you the Adderall. The ketamine is a little more complicated because it's well, no, I don't know how they're getting ketamine over the internet.
So
Ketamine
these cartels are not working on the internet yet?
No, I don't believe so. The ketamine's a totally different issue because there are clinics that are administering it IV, whether that's appropriate or not. But now we're discovering there's clinics that are somehow prescribing oral ketamine. And I to be honest, we're just looking at this, and I don't know that pharmacies, pharmacies usually don't give out ketamine, so I'm not sure how that's being delivered to patients, but it's done through licensed providers.
Yeah, we used to give, I mean, oral ketamine doesn't have great absorption. We used to give it a little bit with patients with CRPS, but not super great for psych stuff. Yeah.
Right. No, the whole opiate thing, prescribing opiates, hit the fan through internet prescribing. So we don't see, become a problem again.
Gotcha. Thanks, all.
Thanks for the chance to talk about this.
Yes, absolutely. I think it's an important topic, and very glad that you brought it up, Steve. Thank you. And thank you for your questions, Joanna, and so great to see you as well.
Thank you. Thank you.
So we'll go ahead and move on to the next item, which is the methamphetamine subcommittee. And I know that committee had been dormant, and we had had a few people that had agreed to restart, and we had discussed about doing that after the legislative session had concluded. Has that committee been able to meet yet?
Not that I'm aware of. And I had a tangential question to that, and maybe Dominic can speak to this. Those, I know I was aware at the beginning of the legislative session that the recommendations that were put forth by that were incorporated in various proposed bills, and I'm not sure what any of those are. And so if anyone has some clarity on that, that would be very cool.
Sure. So I can say, Phil, that with regard to the mobile outreach units, some of that is incorporated in some of the funding that was allocated to as far as for the opioid settlement monies. And so that will be continuing to move forward. And then with regard to the contingency management, I hadn't heard anything specific, but a lot of that work was going to be done through some of the regulatory side rather than necessarily legislative, but is still on the table and is still moving forward. At least that's my understanding. Does anybody else have any other information or with regard to either of those? No? Okay. Great question, Phil. Thank you. All right, so we will see if we can get that group together and see about starting to schedule a meeting before our next larger council meeting. And then the next item is the integrative medicine, and I did see Michael on. Michael,
Yes.
I'll turn it on over to you.
Thank you. So we met last Friday and we spoke about further action steps to continue improving access to integrative treatment options. We plan to work directly with the Primary Care Association to increase awareness of the inclusion of the chiropractic medicine in turquoise care starting next year. We also plan to work with the UNM Health Sciences Center to publish statistics specifically for the healthcare workforce report so that the governor and the legislature have more information about access issues that the state has. And our individual professions will be continuing to make presentations to the Legislative Health and Human Services Committee, as we pretty much always do during the interim sessions. And I think we're moving forward. We don't have any new recommendations. We're just going to keep working on the ones that the group has already voted on over the years. So thank you for all the support. And that's all.
Thank you, Michael.
Any questions?
Yeah, and does anybody have any questions for Michael? There's really been a lot of progress made, so it's actually been really great especially over this last year. It seems so many people in all of these various subcommittees and on the council have been working really hard. And I just really want to reach out to all of you and actually acknowledge that with all of you, because I think we've seen a lot of strides, especially in the last 6 to 8 months. So it couldn't be done without all of your work. So thank you all. Okay. All right, Michael, is there a next meeting scheduled?
Yes, there is, and it is going to be, I believe, June and June 2nd, 1:30. Yeah, June 2nd, 1:30 p.m.
We'll see about getting that set up for you and getting that published.
Excellent. Thank you so much.
Perfect. Thank you. And Phil, I forgot to ask you, is there a next meeting for the emerging trends?
There is not. I was just mulling over that, and if the council is in agreement, I think once some of the test results and things that we're all waiting for and stuff come together, I think I can send out like a doodle poll or something, and anyone who's interested in getting in on working on that, to as we get more information, we might have some ideas about policy recommendations and things that might be worth pursuing. And I think, yeah, we could definitely include Scott if he's available. I think Brandon, and anyone else who's interested in that. So I think we can coordinate all of our data and stuff. Yep.
Okay, great. thank you, Phil. That sounds good. And definitely, as far as getting some ideas as far as policy and recommendations would be very helpful. So, okay, and so our next item is actually other business. Are there other questions or items that we need to bring on up? I think we've brought up quite a few, and especially thank you, Steve, for the ones you brought up, and Phil. But are there other items that we need to consider at this time?
I have a question.
Yes, Joanna.
I was just interested in if the council or the Department of Health can influence the rollout of the over-the-counter naloxone in any way, shape, or form. I hear it's not going to be until kind of summertime and single dose, and I'm not, holding my breath at all, because I think a targeted approach is where the money is. But, I just feel like if it is available over the counter, we ought to really maximize, make it sure it truly is over the counter and not behind the pharmacy wall, if you know what I mean.
Right, and I'm not really sure who that is falling under at this point. Oh, Phil, you have your hand up, so maybe you have some information.
I don't know that I have a whole lot of information, but there is a colleague of ours who sits on, he's a pharmacist who sits on the national board of Farm Lubes or whatever, and we did have some conversations. He kind of had a smaller meeting with some harm reduction folks about this a couple of months ago, and they were already playing with ideas about product placement and all that kind of stuff in like what that would look like for like to be able to make recommendations to the chain pharmacies and other pharmacists within that. So
Yeah.
we were talking about like near the counter, like, how in Walgreens they have things like random things like, I don't know, batteries and disposable cameras, and how it becomes gradually more things that they lock up, and then it's cigarettes behind there, like somewhere right there, so that people have to go deep into the pharmacy to look for it or have to ask for it, or people can pick it up because it's all of a sudden they see it or whatever. So those were some of those considerations were already being discussed at the level of the pharmacy associations and things.
And I do think that Andrew Knox made a good point that because we give it away for free through so many different sources throughout the state, there's probably going to be a slower uptake for people buying it because we have so many other resources and options, unlike many other states. So I think that's a good point.
I do think, in urban areas, my wonder, Dominic, though, is in urban areas. I mean, I'm thinking of Albuquerque, but I do think there's going to be a run on it, for maybe not for people who use drugs, but for family members. That's just what I'm thinking. But I'm totally agree with Phil that it has to be a place that's easy to grab, easy to buy, and especially like with these pharmacy chains, some of them where you can actually purchase it yourself, like scan it, where you can purchase it where there's no stigma attached. I think that it has to be available like that and not behind a paywall kind of thing.
Right.
Yeah. I mean, there's still so much when Dr. Bada and I and some other folks went to around the state, not even that long ago, we couldn't even, we couldn't even ask for it without a lot of questions. I mean, so much stigma still abounds that I'm worried about it, but that's just, I'm just really worried about it.
Yeah, and completely understand and agree with you on that, Joanna. I just a couple of months ago went to go take care of that for a family member who needed some. And yeah, the pharmacist at the particular location I went to was just, as I like to call it, they gave me the "Are you a drug user?" side eye. So, and attitude throughout. So
That's nice even. Yeah, that's nice. A couple pharmacists wouldn't even give it to us.
Yeah.
The third, yeah. I mean, I'm not saying that's nice, but
But, yeah,
yeah.
I'm being
just-
polite.
Yes, exactly, exactly.
So
Yeah.
Neil, you have your hand up?
Yeah, I just wanted to point out that for what it's worth, I asked my prevention people at BHSD if they thought that over-the-counter naloxone would impact our naloxone saturation planning or implementation, and their response was really not. That they think that many avenues, as Dominic pointed out, that we are distributing it basically for free for people, will not be impacted by this at all for a number of years, was their response to it. And in some ways, I hope that's right, because I think we've got a distribution method that kind of avoids the stigma that gets attached to it in other locations. But I completely agree with what you're suggesting, Joanna, about the if there is any opportunity for the state to chime in on the federal regulations about having it over the counter, then things we could do to reduce the difficulty of acquiring it is a good idea.
And again, for those who are on the phone, Chris Trujillo put in the chat that ordering online would probably be an option as well for those who don't want to purchase brick or mortar. And that obviously could help to reduce some of the in-person stigma and issues that can occur. But that is also for those who have addresses, can receive, can receive packages, all those sort of things. So that's a consideration too.
Yeah, just overall real quick, so Josh. Yeah, it'll be late summer, and I think the first product that's going to be out there is the branded Narcan product. So my guess is that it's going to be expensive. We pay $35 for special interest price. If you get it from the pharmacy without insurance, you're over $100. It's going to be lower than that for OTC, but I don't imagine it's going to be in that affordable range where someone's just going to be like, oh, look at this, I want to pick it up. And I agree with Neil's team's assessment. It's going to have pretty minimal impact on programming throughout the state. Going to have some minor impacts with some, labeling and log things, but other than that, it's going to be very minor here in New Mexico. But yeah, that's kind of what I.
Thank you, Josh. Okay, any other comments, questions? Okay, any other business? Okay, not seeing any. And just to give everybody just another moment in case I missed somebody's hand or anything, any other items for today? Okay, well then we'll be moving to our next item, which is scheduling the next meeting. And again, usually we do this on the second Friday of the month, which puts us to June 9th. And so will June 9th at 1:30 work for the majority of people who are here? Seeing thumbs up. All right, I will put that down. We will get that information on out and we'll get it up on the website as well. And other than that, that was our last item for the agenda. So thank you, everybody. We do have a couple of follow-ups where we'll get some information out. We'll send it through the Google group so that people have access to it. We look forward to seeing everybody again in June. So thank you, everybody. Have a great weekend.